So, thank you for joining me. I know that if you are interested in the field of psychology, it can be pretty overwhelming to try to decide what to do within the field because there are so many options of things to do, so many subfields. I'm going to talk about my professional experiences as a psychologist. I've been working in the mental health field for 24 years, so I have a little bit of knowledge about certain subfields, and tonight I'm going to talk about school psychology or the role of a school psychologist. But before I get into that, I just want to back up a little bit and talk about, I have to refer to my notes. One thing that a lot of people ask me, how I got interested in the field of psychology. That's one of the most common questions that people ask. And I always tell this story about when I was in middle school and I was doing a science fair project, and that project was on reaction time, which now thinking about, and I was in 7th grade. I don't know why I wanted to do a project on reaction time, but I did. And what I did was I had a ruler that I dropped, and people had to catch it, and I timed how quickly they actually were able to catch that ruler, right? And what I discovered that some people were able to catch it very quickly. Some people, it took them a lot longer. And from there, I had to, I don't remember exactly like what the specifics were about that study that I did, but I know that I had to research what was possibly interfering with some people's reaction time. So why were some people able to catch this ruler faster than others? And I had to go, and as I started to research that, I came across research on human behavior. And that is how I got interested in the field of psychology in general. And that was in 7th grade. And so since then, I have wanted to learn a lot more about human behavior, what motivates people. I don't think at that time I actually had the idea that, oh, I want to actually help people, but I was really interested in research and learning how people have learned about human behavior. And so I set my mind that, okay, I want to become a psychologist. So then when I got to high school, I learned about clinical psychology, which I will talk a little bit more about probably tomorrow night. And I realized that I could probably work for myself, and so that sounded really appealing. And I pursued that when I went to college. So once I got to college, I met my advisor, who was at Howard University in Washington, D.C. Shout out to my alma mater, HU. And one of the things that he urged me to do was to consider a subfield of psychology called school psychology. And I had never heard of that before. And even to this day, there are people that work in the mental health field and people that work as psychologists who have never heard of school psychologists. But every school has a school psychologist assigned to the school. But most school districts actually have multiple school psychologists assigned. So if you never came in contact with the school psychologist or never knew that there was a such thing, it's probably because you did well in school. School psychologists in most districts, and I worked about 8 years as a school psychologist. I started out working, and I just realized I want to back up because I jumped in with the assumption that everybody has the same knowledge base about psychologists. Some people actually confuse psychologists with other mental health professionals. Oftentimes people confuse psychologists and psychiatrists. So let me just back up. So psychologists are experts in what I call the CAB, the cognitions or thinking. The A stands for affect or emotions or feelings, and the B is for behavior. So we find ways to help improve people's lives by helping them to address unhelpful thought patterns, or helping them to address emotions that are flooding their system, that maybe paralyzes them or interferes with them being able to achieve certain goals or certain behaviors. And there are different ways that psychologists use those skills. So that's just a very general overview of what we do. We are not medical doctors. There are, I believe now, 5 states where psychologists can get specialized training in psychopharmacology and be able to prescribe medication, but generally psychologists do not prescribe medication. We don't go to medical school, we go to graduate school, and that's, the biggest difference between psychologists and psychiatrists. One is a medical doctor, one is a mind doctor, and generally one approaches from a biological standpoint of what's interfering with thoughts or interfering with your ability to manage unhelpful thoughts or emotions or behaviors. And then one, and that first one being a psychiatrist, looking at things from more of a medical model. And there are plenty of psychiatrists that actually do therapy as well, but the thing that separates them from psychologists is their medical training. Psychologists generally do more therapy, particularly clinical psychologists, than, say, a psychiatrist. And again, I'll talk a little bit more about that type of psychologist later. But tonight I want to spend more time talking about school psychology. So back to school psychology. So my advisor at Howard University said, hey, I know you're interested in clinical psychology, and that's kind of a popular thing to do when people say they want to become a psychologist. They see people on TV sitting at a chair and somebody else on a couch, and they're doing therapy. And it's like the stereotypical psychologist that people think of when they think of a psychologist. But he said, I really want you to consider the area of school psychology because number one, there aren't that many African Americans who are school psychologists. And the biggest reason, in addition to that, is that there is a disproportionate number of African Americans, particularly African American boys, that are being referred to special education, and the school psychologist serves as sort of the gatekeeper. So in some ways, in some school systems, school psychologists will receive information as far as screening information about students who are having difficulties, and they will be able to give feedback to the teacher or the administrators on ways that they can differentiate the curriculum, or suggestions on behavior management strategies that they can use before making a referral for special education consideration. So that really excited me because it made me feel like I could have a major impact in the trajectory of some people's lives, because not to say that special education is a bad thing, but if the U.S. Department of Education has said that there's a disproportionate number of people being referred, meaning that they seem to believe that some of these referrals were unwarranted, and that people had not exhausted all the other resources in the school system before referring these kids, especially black kids, black boys particularly. They hadn't exhausted everything else, so they're just like, oh, he's acting out, okay, he going to special ed, right? So I felt like it would position me where I could have an impact on some of these people's lives, to help them learn how to use other skills, and help teachers learn how to bring out some of their other skills, teach them from the perspective of whatever their learning style is or their strength, and hopefully open up more doors for that student along the way. Because unfortunately, sometimes when people are referred for special education services, it limits the options that they have afterwards. And for many, that is appropriate, because that may be the level of support that they need academically, and then maybe go on to do something differently. For others, it may be that they didn't get enough support at the lower levels, and so they have these gaps, not necessarily because they have a disability, but because they just were not available for learning for whatever reason, whether it be them not being open to it, and just kind of being closed off because of the way the instruction was delivered, or the instructor or the teacher not really looking beyond what they're basically taught in school, as far as how to educate kids. Because many people will say, hey, I'm not equipped to teach a student that has these behaviors or these types of emotional outbursts or these type of learning challenges. And in fairness to the teachers, I understand that it could be overwhelming, but I think as a system, the school systems really need to, and I did see in some places where they were starting to create more programs that were programs that help to address challenges with learning difficulties and behavioral and emotional difficulties before making a recommendation that a person be evaluated for special education services. So I don't know that I specifically said that a school psychologist, I think I went off on a rant. Anyway, so a school psychologist, I did say serves sort of as a gatekeeper in many school systems, because they are the ones who actually do the psychological or psychoeducational evaluations. And I'm seeing some things come in my practice. Have I had to deal with boys who act out because of outside influences? So when I worked in school and hello, Mr. Griggs, good to see you on here. Aloha, I should say. So when I worked in school systems, I definitely saw that. I worked and I moved around a lot. I started out in the District of Columbia Public Schools. I went to school in Washington, D.C. And I definitely saw that people, the kids and the boys and the black boys particularly, were influenced by those other social groups outside of their families, and maybe they saw those people as their family or extended family, or maybe their families were embracing those activities as well, as far as you know, gangs or people that were doing things that probably were having a negative influence. So in the district, I've seen some variation of that in all places that I've worked in the school system. Because I worked in District of Columbia Public Schools, then I worked in a private school that at that time it was designated as a psychoeducational school that was for dually diagnosed children and adolescents, and most of them had some type of developmental disability as well as emotional or behavioral difficulty. So many of the students that I have that have been referred for an evaluation, usually an emotional or behavioral assessment, when I was in the school system, either had some involvement with juvenile justice, or like you're saying here, had some outside influences, meaning outside of their home, that was making school less appealing. And so it wasn't necessarily that they didn't have the ability, but they weren't motivated. They didn't have the same motivating factors. And a lot of times it's not cool to be in school. It's not cool to do your work in some places. I also worked in Alexandria, Virginia, in Alexandria City Public Schools. I worked in Clayton County Public Schools here in Georgia for about 3 years, which is, for people that may not know, it's right outside of Atlanta, south of Atlanta. It's actually where the airport is located. And then I worked in Hawaii, Hawaii Department of Education, for a year on the Big Island, and their system is set up a lot different in that they have a lot of layers of support. They actually have a school-based behavioral health program there, which, from my understanding when I was there, it was created out of a lawsuit where people may not have been getting all of the evaluations or resources that they needed in order to be successful in the classroom. And I also worked in for a year in the Virgin Islands, mostly on the island of St. Thomas, but I did some evaluations on St. John. And so some things are I don't know how to say universal. There are some things that you see across groups and across cultures, and one thing that I've noticed is that a lot of the educational systems are doing the best that they can with what they have, but they don't have the resources. And so as a school psychologist, in some cases you have opportunity to introduce new resources or programs. You may not be able to implement it yourself, but you can at least bring new things, new ideas to the administration for them to consider. And in my experience, they have been very open to those things, because they don't want to suspend children, and they don't want to unnecessarily refer them to special education services. And again, not that it's bad, but historically there's been a disproportionate number of people, particularly African American boys, referred for special education services. So going back to how I got into school psychology, my advisor urged me to consider that as an option as far as career, because I could not just help this one individual, but I think he felt like I would be able to help to shift the whole system in a way, sort in a way where possibly the mindset could change. And I hope that I had just a little bit of an impact in some of those systems where I work. Today I looked at some of the stats, and I'm trying to find I'm gonna take a picture of this. So for school psychologists, based on a survey that was done, I think this is the 2019-2020 survey, the membership survey for members of the National Association of School Psychologists, and that's an organization that sort of regulates the practice of school psychology. I'm going to see if I can. I'm not proficient at this slide, but anyway, if you could see this blue part. So the blue part represents that is 86% of school psychologists, and they are white. Okay, and then if you see here, the fractions are so small that they just all of these make up the rest of that. So there's 1% American Indian, 2% Asian, 4% Black or African American, looks like 0.06% Native Hawaiian or other Pacific Islander, 3% more than one race, 2% it says self-described, and I'm not sure what that is, and then 2% no answer. So this is a field that is pretty much dominated by non-BIPOC, I guess, professionals, and I think it's when you are a school psychologist, you do a lot of testing, and the testing is standardized, meaning that you have to follow a certain protocol, and a big part of making sure that you get accurate data is making sure that the person is going to be willing and open to talk to you. And historically, and not always, but these African American children are happier to see people that look like them, and they're a little bit more open, and the African American adults, to be quite frank. And so there needs to be representation of different people, I think, in order to, one, for people to do research about different groups, and I'm thinking specifically about testing and the tests that we use, like IQ tests or academic achievement tests, these tests that help us to make these major decisions. Sometimes there aren't even ethnic minorities included within the groups what they standardize the tests on. So that's another story. But anyway, so whenever you go to evaluate somebody, if they're closed off, if they're like, I don't know you, I don't trust you, the data that you get is not going to be accurate. It's not going to give you, what, obviously there is a range of where somebody's cognitive abilities lie, but it gets pretty static after a certain time frame, pretty early on. There's not a lot of fluctuation in the scores unless somebody just was not participating. and people make major decisions about these children and their lives. So yes, I see. You said you live in Chicago. Yeah, yeah. So I can imagine that. I don't know anything personally about what the life of a school psychologist is in Chicago, but I could imagine it being a challenge if there is uh, a big issue with gangs and gun violence and this broken family. I mean, that unfortunately is a reality in lots of places. It might just manifest itself a little differently. So uh, you may not be interested in psychology or school psychology, but you probably know somebody who is. And I would encourage you, especially if it's somebody that is in college or somebody that is starting college or looking in that direction, or maybe somebody that's already in the field. Like I said in the beginning, many people within the mental health field, they don't realize that there is such a thing as school psychology. And we kind of are like hidden off, it seems, because usually we don't sit in the school per se, because we may serve 2 to 3 schools, and our office may be somewhere else, so we go to the schools to do the evaluations and testing and evaluations. That usually is the primary role of school psychologists. I know when the last time I was working as a school psychologist, which was 2016-2017 school year, when I was in the Virgin Islands, things were changing, and they're trying to have school psychologists do more than testing. I know that in Georgia, in Clayton County Public Schools, where I worked before, we did a lot of things. We did crisis response or crisis intervention. We did training of the staff on the referral procedures, referral for special education, and response to intervention, meaning what kinds of interventions are you trying before you make a referral, and how is the child responding, and how are you adjusting if they're not responding. We did counseling. We did lots of things there. So there's a wide variety of what school psychologists can do, but every system is a little bit different. So I see. I don't want to say it's Miss Brown, Shania Brown. I have a master's in clinical psychology, want to get my doctorate, but struggling with the PsyD versus PhD versus school psychologist. I'm torn. Okay, so seems like school psychologist is less prevalent here in Louisiana. I often look throughout different parishes, so rarely have seen positions, but so that's interesting, because I see tons and tons and tons and tons of school psychologist positions. There is a huge need for school psychologists, and if you want to talk more offline, we can, but I will address what you said a little bit. So first of all, you want to get a doctorate. So PsyD versus PhD. Historically, the PhD was more of a research-oriented degree, meaning that there's a big focus on doing the dissertation and collecting all the data and all of that. But you also do the clinical work. PsyD programs or more clinically focused. So I have a PsyD, and from the time I hit the door, I started doing clinical work, literally. And so some PsyD programs are very heavy in the clinical in that way. And we also did research, but we didn't do a dissertation. We did a major area paper, which involved sort of a case study with research to back a hypothesis about what we thought was contributing to the person's problems and things of that nature. So there's a research component, but what I have been seeing, so I have had to supervise some doctoral students in my current position, which I'll talk about not today. And I see that it seems like they're both trying to move more like the PsyD is trying to incorporate a lot more research, and the PhD, some of those programs are bringing in more, giving more opportunities for clinical work, and not just when you do your internship or just before the internship. So that historically has been the biggest difference between the two. I've heard people say that PsyD programs are more expensive, and I've also heard people say that some PsyD programs are maybe less competitive because they may have more slots versus a lot of PhD programs might have like 2 to 4 slots a year where they let people in, and some PsyD programs might have 10, 15. So I haven't actually looked at the stats on any of that in a while because I've been out of school since 2005 for a long time, but I have seen, you know, those two comparisons as well. Let's see. So one place to look for jobs for a school psychologist is the National Association of School Psychologists website, and I think it's NASP.org or NASPonline.org, but I can look it up and send it to you if you like. Let's see. So if you're interested in school psychology, and you want to work with children and adolescents, I would definitely say, even if you did it, like this is how my advisor, he proposed it to me. He's like, okay, I know you want to be a clinical psychologist, but you can make money quickly because school psychology is the only area, I think, aside from maybe industrial and organizational psychology, but the only area as far as type of psychology that does clinical practice where you can call yourself a psychologist without having a doctorate or without being licensed to practice independently. School psychologists, most of them require what's called it's a degree or a credential that's midway between a master's degree and a doctorate. So some places call it the EDS, the educational specialist. Some places call it the AGS, Advanced Graduate Certificate. At Howard University, where I got my certificate, is called the CAGS, Certificate of Advanced Graduate Studies. So it's basically a master's degree program as far as credits, but it is as far as looking at where it lies in that hierarchy, it's it's beyond the master's degree. So most school psychologist positions require that EDS or that specialist. I know when I started back in 1998, which seems like so long ago, in 1998 I got my master's degree and I started working as a school psychologist in DC Public Schools, and at that time they were certifying school psychologists at the master's degree level, and at that time it was rare, but there were, I think, a few states that would certify school psychologists at the master's degree level, but most require that specialist, or they call it, I forgot, something like level 6 or something like that. I'm not sure. But if you're interested, you could go to the Georgia Department of Education website, and they can, and I'm just assuming that you're in Georgia because I think I've seen, yeah, I know that we're connected on Facebook, and I've seen some of your stuff, but I don't know if you're in Georgia or not. But you could go to the National Association of School Psychologists website, and then they can inform you about where to go to learn more about the credentials or the requirements for each state. So whatever state you're located in. Yes, I would be more than happy to talk to you about psychology in general, about school psychology, or whatever area of mental health that you're interested in. 7 years in mental health, working with children and adolescents, doing mental health community based. Now, one thing I will say, if you are interested, oh, you're in Louisiana. Okay. So if you're interested in doing therapy, school psychology may not be the choice for you. Now, when I worked in DC Public Schools and a little bit in Clayton County Public Schools, I did some counseling, but not a lot. I probably did the most when I was in DC Public Schools, and again, that was a long time ago, so I don't know what the setup is like now. But if you just like, I love doing therapy or doing counseling, or that's what I want to do. Most school psychologist positions are assessment based, or testing, or consultation. So you probably would have the opportunity to, if you wanted to maybe do a group or see some people one-on-one, you might be able to do that, but more than likely it would not be your primary responsibility. And in some school systems, school psychologists, they don't do any counseling. I know when I was working for the Hawaii Department of Education, they had, I had done all those things in the school system here in Georgia, and then when I went to Hawaii, they had all these different people to do all the things that I had done. So they had the school counselor who did some of the things that I had done before. They had the school psychologist who did all of the educational testing, meaning like tests to look at academic subjects, things that you learn, reading, math, writing, that kind of thing. They had what they call school-based behavioral health. Behavioral health, I guess they're like behavioral health counselors. We call them SBBH, but that was actually the name of the program. I think in on some other islands they call them BHSs, behavioral health something. I can't remember what the S stands for. But anyway, they did the therapy, and then I was the clinical psychologist that did the clinical supervision of the master's level therapists, and I also what else did I do? I did the emotional and behavioral assessment. So that the children and adolescents that had any behavioral difficulties or emotional problems that were suspected of having a disability, or that people thought needed to be evaluated for special education consideration, I did those evaluations. But I always joked and said, when I got to Hawaii, I was like, this is my retirement job. I'm too early in my career, because when I was in Georgia, I'd done all these things that they had 5 people, to do those things. So I just, my job was very narrowly focused, which now looking back, I'm like, that was great. I wish I had that now. So let's see. No, I would love it, but got burned out on it. I would love to administer therapy if it's necessary. Okay. So if you're if I'm understanding your comment correctly, you're like leaning towards therapy. Is that what you're saying when you say no, I love it? Then you might not want to consider it for long-term school psychology, but it's a very lucrative career. Like, you can, shortly after finishing your training, you would most likely be able to find a job, because there's a huge demand for school psychologists. And if you start looking on Indeed, you have to know like where to look. I think once you start putting your resume out there. Oh, not leaning towards therapy, but would love to be able to do that if necessary. Okay, well then school psychology is probably for you because usually if you had the time and you wanted to do it, or somebody asked you, that nobody would turn you down, but most likely that wouldn't be the primary responsibility. Yeah. So I'm trying to think if there's anything else that I want to cover about the school psychologist path. Again, you would have to go to the college, obviously, then go to, usually you would get a master's degree and then go on to get that EDS, and even some EDS, or the Advanced Graduate Certificate, and even some school psychologists go on to get a doctorate, but that is not a requirement, and that's why I think my advisor has suggested that I at least start out as a school psychologist, so that I can one, get some experience in the field, even if I knew that I ultimately wanted to go on to get a doctorate and do clinical psychology, and then I could already start working and making money. And that really literally happened like immediately after I got my master's degree. I got a job, and that first year was very stressful because I went into a school system that was very behind if it's possible to obtain the EDS online. I don't know, but if you go to the NASP website, they will tell you which programs, because and this is another thing I think to be important, to make sure that your program is accredited by the National Association of School Psychologists, because when I was in my master's program, I guess, the doctoral program there had just lost their accreditation, and I was considering going into a school psychologist doctoral program at one point, but that would have limited my options to have completed that program. Yes, I see I have another person who has logged on. So you said, okay, I wrote that down. I'll have to do some research to be sure. Yes. The NASP website, it actually lists the programs that are accredited at the master's level, at the EDS or specialist level, and at the doctoral level. And again, if you want to ultimately be able to practice psychology independently, then that's when you would really consider the doctorate. So if that's your ultimate goal, then yeah, I would say go ahead and pursue the doctorate. But in the meantime, if you wanted to start getting more experience doing the testing and assessment, maybe look at one of those programs. Yeah, I don't know if there is one. I want to say that I've seen one, but I'm not 100% sure if there's one online. Um, More than likely not, because there is a requirement, a practicum requirement, and it's kind of hard to monitor those things when you're doing it online. But it's not impossible. So I'll try to go and look and see if I can find it quickly once we're done, and I can um, I can send it to you through Messenger if that's okay. At least send you the link where all the schools are that are accredited. So I don't know, I lost my train of thought. I think I interrupted myself, but you said something that made me think of the accreditation, which is very important because some people complete programs and then they learn that it is not really worth anything because the school or the program didn't have the appropriate accreditation. So, in order for you to get your certificate to practice school psychology, which generally comes from the Department of Education in your state, you would have had to have completed a program that was accredited, most likely. Or if not, you'll have to do a lot of extra hoops and documentation. It's 9:04. Okay, so I'm gonna wrap up, and tomorrow night I will talk about how I made a pivot from school psychology into it's clinical psychology, but it is military focus. I don't know that there is such a designation as military psychology, but I often refer to it as military psychology. And I'll come back on at 8 o'clock tomorrow and talk about that. And Ms. Brown, I'll send you a couple of links. Okay. All right. Good night.